Officials here at City Hall are claiming some success when it comes to vaccine rollout in Toronto, with large numbers of people showing up at mobile clinics in hotspot areas. It's a sign that some of the community efforts are working, but could it end up backfiring? An increase in demand and limited supply of COVID vaccines adds up to this. People camped out overnight for a shot, as though it were a concert ticket.
Yeah, it's been long, but everyone is maintaining the line and the volunteers are taking proper care of it, so it was really nice. So it's been a long wait, but finally we have got the number.
Hotspot mobile clinics have become destinations for those living in specific postal codes. If you're in M2J, for example, you wanted to wait your turn at Parkway Forest Community Center.
Yeah, I think for me to get vaccinated is help to stop spread the virus. And I just want to be helpful to the community, and I just want to be supportive.
Those living in the Black Creek Jane Finch neighborhoods, or M3N, were making their way to Driftwood Community Recreation Center on Monday. Over the weekend, thousands gathered at the basketball courts on Tobermory Drive, a clinic put together by a variety of health teams and community organizations.
But this is not about vaccine hesitancy anymore. This is really about, bringing better access to vaccines and taking an equitable approach and making sure that the people who really need the vaccines are the ones that get it, even if it means bringing it to their doorstep.
The grassroots success that community organizations have had getting people to show up could lead to frustration, though. Just 750 doses were available at Parkwood, with limited numbers elsewhere. Vaccine supply shortages have recently forced some GTA clinics to temporarily shut down.
My sincere hope is that supply issues that have been experienced over the past many weeks, you've heard us talk about that, will start to resolve, and that we'll be able to better meet the demand and the interest that has been generated.
Yes, you have a lineup. That's a good thing. I mean, the lineup disperses eventually because people get vaccinated. And that's exactly what we're going to continue to do, as I said, over and over and over again for many weeks to come.
At least that's the hope, both for those administering and making shots available, but those who choose to be on the receiving end as well.
We live in a hotspot right now. It's M2J, and it's a really good opportunity, though. We have to come very early, but I think it's a very good initiative for providing vaccine to 18+. So otherwise, we don't fall under any other groups.
York Region has now also announced that it will be prioritizing postal codes as well. 5 different areas are going to be changing the vaccine eligibility age to 35 years and over.